thank you so much, everyone, for joining us today and giving us an hour of your time for this informational webinar about Columbia Business School Executive Education's upcoming online program, Digital Transformation in Healthcare. We are so thrilled to have all of you here with us today. I would love to introduce our amazing speaker today. We are so thrilled to have our program leader on the line with us today. Not just one of our best program leaders, but she's run the last 11 or 12 cohorts of this program. No one in the world knows this program better than her. Rebecca Thomas is on the line with us today. Rebecca, good morning.
Good morning. Hello, everyone. I'm so excited to be here with all of you. Like Mark mentioned, my name is Rebecca, and my background is in the tech entrepreneurship space in healthcare. I've worked in health tech incubators, directly on health tech startup teams, building university health innovation centers, and worked in global programs focusing on the strengthening and scale of health entrepreneurial projects. I currently work in the healthcare impact investing space and have primarily worked in both Chicago, New York, and now Latin America. And I currently just moved from Boston, Massachusetts to Bogota, Colombia, and I'm working for the Latin American sector of a healthcare impact investing firm. And I currently have a MBA in the health sector, a master's in public health with a focus in global health program monitoring and evaluation. So I'm very excited to be here with all of you. And I'm happy to tell you a little bit more about this course on a week-to-week basis, what it looks like.
Rebecca, thank you so much for that. Thank you for introducing yourself. Thank you for being here today. Boston's loss is Bogota's gain. Thank you so much for being here today. So yeah, everyone, while you're still logging in today, if you just joined us, we're just saying hello in the chat. Well, you haven't started with the overview just yet, but don't worry, I'm going to be handing you back to Rebecca real soon, going week by week, module by module about this incredible program offered through Columbia Business School Executive Education. So with that, I would love to, so Rebecca is your program leader. We're going to be talking a little bit about what that means. In short, Rebecca is going to be the one who's really going to be guiding you through the program, offering you feedback on your assignments, holding online office hours. But first, I want to introduce you to the amazing Columbia faculty who built this course. First and foremost, I want to introduce you to Professor Carrie Chan, who's Professor of Business Decision Risk and Operations Divisions at Columbia Business School. At Columbia, Professor Chan teaches the core MBA class Operations Management, and her primary research interests center on data-driven modeling of complex stochastic systems, dynamic optimization, and queuing with applications in healthcare operations management. Her current focus is on combining empirical approaches with mathematical modeling to develop evidence-based approaches to improving patient flow through hospitals, particularly ICUs. Super important because ICUs have gotten so much attention in the past couple of years. Now, Professor Chan has published many academic papers in her area of study, as well as content in the popular press and media. So it's entirely possible that you have actually seen her on your evening news or read something that she wrote for the New York Daily News, Business Insider, or The Hill. And you can see she has multiple degrees from both MIT and Stanford. And Professor Chan is going to be teaching you the lion's share of the video lectures. I think probably around 7 modules or so. You're going to be interacting a lot. You're going to be learning a lot. A lot of the video lectures are Professor Chan. But we also have Dr. Frank Lichtenberg, Kane Brothers and Company Professor of Healthcare Management in the Economics Division of Columbia Business School. And Dr. Lichtenberg teaches Economics of Healthcare and Pharmaceuticals in the MBA program at Columbia Business School, and also teaches Managerial Economics in the Executive MBA program. Dr. Lichtenberg serves as a research assistant of the National Bureau of Economic Research and has served as an expert for a whole variety of acronyms that you're more familiar with, including the FTC, the DOJ, and the CBO. His research examines how the introduction of new technology arising from research and development affects the productivity of companies, industries, and nations. He has studied the impact of pharmaceutical innovation on longevity and the effect of computers on productivity in both business and government, and has served as a consultant for organizations wide-ranging from the Walt Disney Company to the National Pharmaceutical Council, and also has a long history of academic publication, including the book Corporate Takeovers and Productivity. There's also an amazing guest speaker with this program. Shara Senior, who's the head of product and marketing at Caption Health, is going to be doing a guest speaker video with Professor Chan, I believe in module 5. Rebecca will correct me on that if I'm wrong, concerning AI in medical imaging and ultrasound imaging, because Shara Senior is an expert in new product development for mature and emerging markets, and we'll be discussing Caption Health's new medical imaging product in a Q&A with Professor Chan. So with that, now we've told you a little bit about who is going to be delivering this content to you. Let's talk about a little bit about the where. Why attend this program at Columbia Business School? Well, in short, Columbia Business School is one of the world's finest business schools, over 100 years old, established in 1916, priding itself on its excellent faculty who provide their students with superior knowledge and thought leadership across divisions and disciplines. Like I said, for over 100 years, they've been providing business training and professional preparation for both graduate and undergraduate Columbia University students. Columbia Business School is the only Ivy League business school located right in New York City. The business school has almost 50,000 alumni spread out all across the globe. And of course, Columbia Business School is, of course, part of the famed and storied Columbia University, which, as you can see there, has alumni that include 85 Nobel Prize winners, 4 US presidents, 29 Oscar winners, and is also one of only 9 colleges in America older than America itself, founded before the Declaration of Independence. So Columbia Business School and Columbia University as a whole is not just one of the oldest, but one of the best schools in the world. And this is a fantastic course that they have built for you. But now that we've talked about who's going to be teaching this content, where you're going to be learning this content through Columbia Business School, let's talk a little bit about why. Why are we talking about the future of healthcare? Why are we talking about digital transformation in healthcare? Well, in short, digital technologies have been revolutionizing healthcare for quite some time now, but how technology is revolutionizing healthcare is changing all the time. So digital technologies are delivering better patient experiences and better health outcomes in ways that are changing all the time. And they're being employed not just by hospital systems, but also by pharmaceutical firms and healthcare companies. Some of the ones that we know of very well now, especially after the past 2 years that we've all had, we've heard a lot about telemedicine and personalized health plans, but those are just 2 touch points. Improved patient care is only one benefit of digital disruption. According to BDO, 74% of companies who are actively investing in digital transformation marked an increase in profitability within 12 months. So that doesn't mean that the other 26% were not profitable. It just means that it might have taken them more than a year or so. But that's just an increase in profitability just in the first year that they invested in this digital transformation. And this program, Digital Transformation in Healthcare, through Columbia Business School Executive Education, will help you lean in to healthcare's next wave of digital. Again, digital transformation is not itself new, but what is digital transformation doing now? What is the new technology coming off the product lines? What is hitting the market? How are places using it? And exploring best practices and technologies that can offer the highest return on investment for your healthcare company. So a couple of statistics there at the bottom. 74% of healthcare executives plan to invest more in predictive modeling last year. That number is probably increasing as predictive modeling only gets better and better and better. But also the other thing that's really interesting there, Deloitte, there's a great article that I found this from with Deloitte, that 88%, which is pretty close to almost unanimous among healthcare executives, who expect wearables to be integrated with care delivery. Now, me as a layman, when I heard wearables, obviously I started thinking of smartwatches, things that you wear on your wrist to count your steps. But that's not just smartwatches. It's also things like smart patches. It's things that can be literally just applied right to your skin that can help with care delivery and improve healthcare outcomes. So you can see that a lot of executives are already planning to invest in this. A lot of executives are seeing that the future is now, and we do not want to be left behind. So this program, this amazing 9-week program offered through Columbia Business School Executive Education, is designed to help you lean into the next wave and also be better prepared to be able to analyze and assess waves after that as well. Because again, digital transformation is always changing. So who is this program for? Well, if you're on the line with us today, we are very confident that this program is for you, that this program will benefit managers and executives with experience in hospital management, life science innovation, pharmaceutical and device research, health technology, insurance, but it would also be beneficial for digital transformation consultants with clients in healthcare. So in short, the three roles that we really decided to focus on. So if that first sentence that I said, if that sounds like you, then this program was designed for you. But we really built this and honed in on three specific people. So if this sounds like you, then you are in the right place. We feel that this program is particularly tailored to C-suite executives. So if you're a highly experienced leader and you're looking to gain a strategic overview of digital disruption in healthcare and be able to modify your business model to adapt to the digital healthcare landscape, then this program is for you. If you're in any role in senior management, if you're an experienced professional and you're seeking to identify digital solutions to implement within your healthcare adjacent functional area and take necessary steps related to data science, you want to understand various stakeholder perspectives, you want to improve the quality of your product, you want to understand the steps required to take a digital project to market at the lowest incurred cost, then this program is for you. But also, if you're an entrepreneur, if you're a venture capitalist, you're an experienced investor or founder, and you're looking to identify the business models and entrepreneurship opportunities in digital transformation in healthcare, and also learn from the successes and failures of other startups and leverage the venture fund strategy adopted by pharmaceutical companies, then this program is for you. And you can see some of those representative roles down there. Like I've said, we've had many cohorts before this one, and we've had lots of students with titles like CEO, CFO, CTO, CIO, COO, VP, Director of Operations, Director of Compliance, Product Manager, Founder, Entrepreneur, Venture Capitalist. So these are just some of the titles that we've seen in our cohorts before this one. These are the titles that we will see in cohorts after this one. So that's just to give you an idea as to who this program is for. But with that, what I'm thrilled to do is, now that we've talked about Columbia, we've talked a little bit about the course itself, we've talked about the profiles of our students. And with that, I'm thrilled to hand things over to Rebecca. Take it away, Rebecca.
Thank you, Mark. Like Mark mentioned before, I have been the program leader for this course for the last 11 or 12 runs for this course, along with another program leader named Juan Sebastian. And Juan Sebastian, he's a biomedical engineer, and he has a master's degree in biomedical computing and also a master's degree in public health with a focus on leadership, policy, and management in global health. He's done research at MIT and Harvard, as well as Oxford, and moved to industry in 2016 and became the director of education at a large medtech company in Colombia. He's also the project manager at Sana MIT Critical Data, and is currently the director of AI and innovation at the Colombian Radiology Association. So the two of us have been tag teaming this course for the last 11 or 12 runs, and we'll both be leading the live sessions for you throughout the course of these 9 modules. Next slide, please. So this is an overview of what the entire course looks like. You can see on the right-hand side the overall names of the different modules and the overarching questions that these modules tackle. By the end of the program, we have a few learning goals. One will be that you'll be able to identify some of these trends in digital health and the challenges within these trends. We've seen that digital health has been evolving rapidly, but there are some shortcomings. So we'll be talking about those and how to mitigate some of those challenges, and what are the opportunities along with that to continue to evolve this digital health landscape. We'll also be talking about predictive analytics and artificial intelligence and machine learning, and what that actually looks like and how those tools play a role in transforming digital health as an industry overall. We'll talk about population health initiatives through a case study that we'll look at of Lehigh Valley Health Center, and we'll talk about what made that case successful and what separates a successful population health initiative from a failed population health initiative. We'll also talk about resource allocation and waste in the medical industry, and we'll talk specifically about lean operations and how that strategy can help to address resource allocation and waste through digital health. And then we'll, at the end of this course, be looking at health technology assessment through the modules led by Dr. Lichtenberg. And we'll talk about how to quantitatively assess the price of pharmaceuticals and technology advancements using the HTA methodology. Next slide, please. So now I'll take you through this course step by step, week by week. The first week really lays the foundation for the entire course, and we'll be talking about the state of healthcare. We talk about a number of healthcare systems, but there's a particular focus on the US healthcare system in comparison with healthcare systems across the world. So we'll talk about it in a couple different ways. We'll talk about the current state of the US healthcare system using 5 key performance measures, and talk about healthcare outcomes. So what does life expectancy look like in the US compared to other nations? And why, for example. We'll also talk about the government's role in rising healthcare costs and whether their involvement is likely to increase or decrease in the future. We'll talk about the major Ps, these major stakeholders in the industry, providers, producers, and payers, and what their role is, what their challenges are, and how we can mitigate these challenges through collaboration between these different stakeholders. And we'll also talk about the historical challenges that have faced the US healthcare system and the opportunities through digital health that are being created to help to mitigate some of these challenges. Next slide. In the second week, we'll be talking about population health. So essentially, population health is usually taught as a subsect under public health, but it's interesting to see how public health is permeating into the digital health landscape. So we'll talk about what population health actually is, what are the factors that impact it. Specifically, we'll talk a lot about social determinants of health in this module of the course. We'll talk about different factors that define a successful population health initiative through a case study. And we'll discuss, especially through our live office hours, what does it really take for an organization to be successful in a population health initiative, and what roles do data and analytics play in that success. So we'll talk about specifics of this case study with Lehigh Valley Health Center, and we'll be able to see where they were really successful, where there was room for improvement, and be able to share experiences as a cohort within population health initiatives of what's working and what's not working. Next slide, please. In the next module, we'll be talking about lean operations. There are a lot of strategies that you can use in implementing digital health technologies. Lean operations is one area that Professor Chan has a great deal of experience. So this was the one that she decided to include in this course, but certainly is not the only strategy available to implement digital health technologies. We'll talk about the lean operations framework and how it can be used to identify sources of waste in healthcare and then reduce those sources of waste in healthcare, and talk about what digital interventions can do within that lean operations framework to make an impact on mitigating waste in the healthcare system. And we'll talk about the importance of stakeholders, having healthcare personnel and other stakeholders buy into the implementation of digital solutions in order for it to truly be successful. It is not just the technology that's going to make the difference in this new digital health landscape. It really is the people and the successful adoption of these technologies that will really make the difference and make the impact in this future post-COVID world. Next slide, please. In the next module, we'll be talking about data-driven modules. And in data-driven models, this is a piece that in office hours, Juan Sebastian will lead. And we'll talk about some of the technical specifics of how to calculate the waiting time in a medical facility using the waiting time formula. So this is one technical aspect of something you'll be able to learn throughout the course and be able to think about statistical utilization and how the quality of services is impacted by the size of a system. And you'll also be able to read the results of a data model and talk about some of the key insights and assumptions that are made within data-driven models in order to implement digital health solutions. Next slide, please. In the next module, this is a really fun module. We'll be talking about leveraging predictive analytics. So predictive analytics is one area of the digital health landscape that has a lot of potential. We're seeing a lot of movement over the past couple of years, especially in the implementation of these solutions and investments in these solutions. And so we'll be able to look at some examples of where AI and machine learning are being implemented in the healthcare space, talk about where the opportunities lie, talk about early warning systems and how they can benefit small segments as well as the greater ecosystem of healthcare facilities. We'll also talk about some of the challenges that AI and machine learning face in implementation, especially in the ICU setting. And so we're seeing a lot of movement in this space, but there are organizations like Data for Good, for example, that are looking at how can we implement AI and and machine learning in a way that is equitable, in a way that mitigates bias in the healthcare industry. So these are things that we'll be able to talk about throughout this module. And we'll also talk about challenges in implementation and in incorporation of some of these digital solutions in healthcare systems and how we can overcome some of those challenges. Next slide, please. So in the next week, we'll be talking about what I'm sure most of you are the most familiar with, which is telemedicine. We'll talk about some semantics. What's the difference between telemedicine and telehealth? And what are the differences in the implementation of the two? We'll talk about challenges in more widespread dissemination of telemedicine. We'll talk about how the telemedicine landscape is evolving over time. And one piece that in the past run students have been really interested in learning more about is what this landscape looks like in the US right now, especially in terms of regulation. We're seeing from one run to another of this course that's changing. We'll talk about that in office hours. You know, how many providers or how many states have providers that can serve and provide consults across state lines, and how is that changing over time? We'll talk about in this next run Roe v. Wade and how that's made an impact on telemedicine and how that's going to continue to change regulations in telemedicine over time. And we'll also talk about the different connected health strategies to be able to apply to different healthcare interventions. And we'll also talk about some of the downsides of telemedicine and how to use strategies to avoid some of these pitfalls. Telemedicine is a space that involves a few different categories, and it's not just those consults over video between a patient and provider. So we'll talk about what are the different categories of telemedicine as a digital technology, how are they being implemented, and how can we mitigate some of the challenges in future implementation. Next slide, please. In this next week, we'll talk about data analytics and medical imaging. So we'll talk about some of the models of how data analytics is being used in the medical imaging space. What are the new digital health technologies that are emerging for medical imaging? And this is the module in which we'll have our guest speaker, Shara Senior, talk about her company, Caption AI, or Caption Health, and their product Caption AI. And Caption AI is specifically working towards using data analytics to streamline medical imaging, specifically for ultrasound. And so we'll talk a little bit about that case example and what's working well and where there's room for improvement in this. And we'll also talk about 4 other major categories of where we're seeing data analytics in medical imaging. We'll talk about the new opportunities within it, the challenges, specifically 4 major challenges that we're finding in the medical imaging space. And then we'll talk about some of the future opportunities that lie in the digital imaging landscape. This is one module that I typically lead and an area that I'm very passionate about. And that my own sister works in machine learning for medical imaging. So we talk a lot about this in this course. Next slide, please. And weeks 8 and 9, we take a bit of a shift. So for the first 7 modules are led by Professor Carrie Chan, and then weeks 8 and 9 are led by Dr. Lichtenberg. And so both of these modules are focused on health technology assessment. So this entire time between weeks 1 and 7, we're talking about these different types of digital health technologies, how they're being implemented, what are the challenges, what are the opportunities. And then in weeks 8 and 9, we're talking about digital health technologies from an economic lens, and how can these practically be implemented within healthcare systems and within healthcare related institutions, and how to be able to make that decision to choose one digital health technology over another, and the economic models that go along with making that assessment. So specifically, we'll talk in week 8 about creating a life table and being able to measure life expectancy. And the reason why we're talking about life expectancy is because we're talking about the measurement system QALYs, and we'll be able to talk about quality of life measures and different measures and methods to be able to measure quality of life that are out there, and what are the benefits and the cons to implementing some of these different methods. And then we'll be able to define quality adjusted life years and know how to be able to use that when being able to make some of these health technology assessments. And next slide, please. And then week 9 is the second half of the health technology assessment. So now that we're able to discuss and measure quality of life measures, we'll be able to calculate the incremental benefit of a digital health solution. We'll be able to calculate the incremental cost of a digital health solution. And we'll be able to have a discussion about profitability plays a role in the pricing strategies of these new technologies in healthcare, and how to choose one digital health technology over another. There are 4 case studies over the course of these 9 modules that we'll cover over the course of the 9 weeks. And students often very much enjoy the case studies within these 9 modules, and they were a great piece for discussion in our live office hour sessions. So the 4 are Merck Gardasil. We'll talk about pricing. That's in week 8 and 9 of the health technology assessment. We'll talk about Intermountain Hospital and getting buy-in for a screening tool. We'll talk about the St. Marie ER crowding module case study and how data can address patient waiting time and discharge. And then we'll talk about the High Valley Health Network, which is actually the first case study that we'll look at over the course of the 9 weeks in week 2. And we'll talk about how they implemented Populytics, a population health digital technology, and what led to that implementation success. And with that, I'll hand things off to Mark. Thank you so much, to talk about program highlights.
Thank you so much, Rebecca, for that excellent detailed overview of all 9 weeks of this incredible program. Let me tell you a little bit about some of the things that make this program different than other online programs. In the past couple of years, a lot of schools have been very eager to just throw things online as quickly as possible, just to, expand one of their YouTube channels and say, this is online education. But we have created here at Columbia Business School Executive Education, we've created a dynamic, engaging, interactive program. So it's not just video lectures with Columbia Business School faculty, although it is, we're going to be covering all those modules with Professor Carrie Chan, with Dr. Lichtenberg, and also our expert guest speaker, Shara Senior, with Caption Health, but also real world applications, hands-on application exercises, healthcare case studies. So you are going to get your hands dirty with this program, and you're gonna learn tools and take those tools and be able to apply them to your current and future careers, even while you're learning it in this program. You also see short quizzes there. Some people see the word quizzes and they think, oh no, I don't like quizzes, I don't like tests. Sometimes we call them assessments, and people say, no, I don't like that. But one of the things that I want to focus on is the fact that this program, what really sets it apart is the level of support that you will feel during this program. Not just expert content and expert thought leadership from Columbia Business School faculty, not just our 24/7 program support that will be there for any technical problems you have, not just our incredible program leaders, the backbone of our program like Rebecca, but also those quizzes are designed there not as a form of judgment, but also as another form of support. Those quizzes are there because all this information, all this content, all this knowledge, we want you to be retaining it and able to immediately apply it to your present and future careers. And so those quizzes are there to say like, hey, you really do know this stuff. You really are learning it. We're not just throwing a bunch of stuff at you through a fire hose and saying, well, it's on your own, whether or not you retain this, whether or not you remember any of it. We want you to feel encouraged and supported throughout this program. So every once in a while, there's just going to be a knowledge check to be like, hey, you got this, you know this. All this information you're learning over the 4 to 6 hours that you're investing every week in this program, you're keeping it, you're retaining it, which means that you'll have it now, you'll have it in the future, no matter what is the next wave of digital transformation. Who knows what it is? Probably Rebecca does, but I don't know what it is. So you'll be able to assess it and you'll be able to apply it to your future careers thanks to all these different dynamic tools and opportunities throughout this program. There's also peer discussion and feedback. Our program leaders moderate these discussion boards where you can all check in with each other and learn from each other. And these discussions, these moderated discussions, are a really enriching part of the program. We get so many fantastic testimonials about how enriching it was to be talking to people in the exact same industry on the other side of the world or a completely different industry right down the street, and being able to learn all these different perspectives, global perspectives, also different years of experience. You might be your cohort, you'll have people with 5 to 10 years of experience, 15 to 20 years of experience, sometimes more than 25 years of experience. And you'll be able to take all that experience and learn from each other in those peer discussion groups and also receiving feedback from each other. Now, upon completion of the program, you will receive a verified digital certificate of participation from Columbia Business School Executive Education. Now, this not only serves as a powerful credential, it's not just great on your LinkedIn or your CV, but also it's fantastic because if you put this on your LinkedIn, you'll be able to find members of previous cohorts, members of future cohorts. You never know who might have taken this program 2 or 3 years ago. And you also might find yourself, if this is on your resume, you might find yourself in an interview and discover that someone on the other side of the table also took this program or one of these programs offered through Columbia Business School Executive Education. And immediately you'll find that you have a common language. You have a vernacular that you can share and communicate even easier. And it'll be a huge leg up in that interview room. So this digital certificate, it's a great feather in your cap. And a lot of our students have found it to be a huge benefit in a lot of different ways, being able to connect with other members of past, present, and future cohorts online. And like I said, we've gotten a lot of amazing feedback from this program. And so we just pulled a few quotes for you. What I actually want to emphasize you, obviously, I want to talk about the amazing praise that we've got for this program. But what I really want you all, our future students, to be focusing on is the job titles of some of where these testimonials are coming from. Director of Healthcare Digital Transformation, Senior Director of Business Technology, VP of Strategy, Business Development, and Innovation at places like Cisco, WW, what used to be Weight Watchers, Children's Hospitals and Clinics of Minnesota. So that's the level and caliber of student that we have. And you can see there that what they're finding is the content was very specific to some of the metrics I was not even aware of. These are the things I learned and will use going forward. Program addresses healthcare from multiple perspectives, which is quite comprehensive. Professors are extremely knowledgeable. Classmates were experienced and engaged as well. So you can see we've gotten a lot of praise. We didn't want to include all the testimonials that we have. We just wanted to give you a snapshot of just some of our previous students' experiences. But with that, now program support is actually going to be putting up a link in the chat box that you can click on to register for this cohort. So please go ahead, open up that chat box and click on that link. I do not want you to miss the opportunity to join this next cohort. So go ahead, click on the link, keep that tab open in your browser, even if you can't register for the program right now. Maybe you're listening in on your phone, but even if you can't register right at this moment, you don't have time to sit down and fill that out. Just keep it open in your browser. If you're anything like me, your browser already has 50 tabs open. So go ahead, click on that link, make it the 51st tab open in your browser. You can see there a 9-week online course. Our students invest 4 to 6 hours per week on this program. That is the range, not an average. It's not that some of our students take 2 hours and some of them take 10. 4 to 6 hours per week really is what our students invest in this program. Okay, so what challenges do digital health fulfill? Why transform? What's the ROI? Well, I mean, that's a pretty, pretty big philosophical question. So, Rebecca, like, what challenges are digital health solving right now? Are there some challenges that digital health is not solving, that maybe old-fashioned medicine is still working best? Human to human, human to human healthcare is still working. But why transform? What's the ROI? I mean, these are kind of the big existential questions. That's like why we have the program.
Thank you for your question. Yeah, these are some large questions, and they're questions that we'll be working to answer through the course of the 9 modules. Digital health is not a replacement for in-person healthcare, and that's something that we'll talk about throughout this course. It is a complement to in-person healthcare that can fulfill a few different challenges. And some of the ones that we'll talk about is how we can streamline operations through digital health, how we can better collect data and analyze data on a larger scale through the use of digital health. We'll talk about how we can improve outcomes through digital health and how we can measure those outcomes through digital health. So these are a few, but on an overarching scale, we can talk about how digital health can both improve quality and improve access to healthcare and also minimize costs. So these are just a few overarching reasons of why to transform, we can say, and what the ROI is. That cost savings, those improved outcomes, those are the usual things that we can talk about with return on investment for some of these digital health technologies. Does that answer your question?
Thank you, Rebecca. Can you talk a little bit about the ratio? Because this is mostly recorded videos. So we talked a little bit about, like, you have live online office hours. Can you talk about how much of live components there is with this program compared to video lectures?
The ratio of recorded videos versus live classes. So the recorded videos are what's being led by Professor Chan and Professor Lichtenberg, and Juan Sebastian and I are the program leaders who lead office hours, which are the live portion of this course. And so these live sessions are held every single week. So each week you'll have a live session that talks about the course related to that week. We run through a number of things through office hours. So we'll have an overview of the content in the course. We'll talk about hot news of the week, and we'll be able to discuss what's going on in digital health related to the content within the module that's coming up in the news recently. We'll talk about other use cases of these digital technologies. We'll go through Q&A in our live sessions. And we'll also hold discussions over some overarching questions that we'll be tackling from week to week within the course. So the live classes, or these live office hour sessions, really are a huge value add to the course, and we'll be able to help you resolve any questions that you have while watching the recorded videos.
Thank you so much, Rebecca. So this course, Columbia is an American school. The course feels quite America-centric, but how America-centric it is, because again, especially when we're talking about the healthcare space, Rebecca, as you know, America is an outlier, particularly when it comes to how, like, healthcare is paid for, and the fact that we don't necessarily have government subsidized healthcare as opposed to, like, much of the rest of the world. So when we talk about how America-centric this program is it mostly America-centric, only somewhat? Is it truly global in scope? How would you describe it, having done like a dozen runs of this program? How would you describe it in terms of its America centricity?
Hi, Wale, thank you so much for your question. And I understand why you have that perception that it is America centric. We do use a number of examples and statistics based on the US in the recorded portion of the session. Juan Sebastian and I specifically have specializations in global health, in the digital health landscape. So a lot of what we bring to the live sessions are global examples of what we're seeing in terms of trends in the US. And we'll compare and contrast that amongst different markets. Another thing that's been really useful for the live sessions are that we always gauge what students are most interested in. If students are more interested in seeing examples from Southeast Asia or from Latin America or from Sub-Saharan Africa, we're able to bring in some of those use cases of how these digital technologies are permeating different markets and what that really looks like.
Thank you so much, Rebecca. That was excellent. And also, like, this is also a moment that I really want to plug those moderated discussion boards, because one of the reasons why we have everyone say hello in the chat box is that we know that we have students or we hope future students on the line with us today from India, from London, from Hong Kong, from Singapore, South Florida, Mexico City. So all of your experiences where you are, you can bring into this program. That's the great benefit and the great advantage of those moderated discussion boards. So, as the more of you that participate in those discussion boards and are talking to each other and talking about what is happening in your home countries, because it's very easy to miss what's happening in other countries, like Rebecca mentioned during her presentation during the recent U.S. Supreme Court decision on Roe v. Wade, which obviously, being in the United States myself, is a huge news story and very central to my life and my family's life. But that might not necessarily be true for all people all around the globe. So again, what you bring to those moderated discussions and being able to let people know, hey, this is what's happening where I am. This is what's happening where I am, because what's happening in one country now might be what's going to be happening in your country in 6 months or a year from now. Some places might be innovating in ways that other places might be catching up on. So yeah, so I just want to plug again.
Absolutely.
The more that all of you put into this program, the more that all of you are going to get out of it. Rebecca, what I was thinking about was, I was wondering, is there a huge difference? Because when we talk about like telemedicine and telehealth, what I thought of, because I have many friends and I've even used it myself, here in the United States at least, we get commercials all the time for apps that are specifically for mental health. All these different apps that provide mental health, telemedicine, or telehealth, although apparently they're not interchangeable terms. So I apologize, Rebecca, if I'm using the wrong one at the wrong time. But is there any differences, or are there any subtleties, or what are we seeing right now when it comes to digital transformation, the difference between physical health and mental health at this time?
Thanks, Mark. So the major differences between telemedicine and telehealth is that telemedicine is the term used for diagnosis and treatment through the use of telecommunications technology, but telehealth is a much broader term that can be used for a number of things. One thing is the use of mental health applications. That's one way that asynchronously, even patients can be connecting with mental health providers. That's one way. Telemedicine also covers not just patients interacting with providers, but also providers interacting with specialists and being able to get that secondary consult in. It can also cover remote patient monitoring, which we'll talk about. The way that wearables, just like smartwatches, but other devices as well, can start to collect some of our healthcare data, and the ways that we can use this data to then take charge of our health and make better decisions, and also help our providers make better decisions as well in our in-person consult. So those are a few of the elements that we'll talk about within the telemedicine module.
Are you finding, Rebecca, just because, we're now in the middle of like year 3 of COVID, we're now proceeding into year 3 of COVID. So, you've done like a dozen cohorts of this program, which means you were doing this program pre-COVID, but you've now done several cohorts through COVID as well. Are you finding that there are any, I'm sure that we've learned a lot about various healthcare systems all around the world due to the impacts of COVID, but are you finding that there are like some temporary changes that were made that are starting to go away? Like, how much do we actually talk about the pandemic in this program beyond just what people bring to the moderated discussion boards? Because it really did have a massive impact on global health, national health, things like that.
The pandemic has absolutely accelerated the implementation and the use and the willingness to adopt digital health technologies. And that's something that we talk about a great deal throughout the live sessions of this course, and something that Juan Sebastian and I customize every single time we run this course, because there are always new things going on within this evolution of digital health technology in response to the pandemic. In terms of what things are temporary and what things are here to stay, that's a very astute point that you've made, Mark, that we've seen, for example, the implementation or the adoption of telemedicine, for example. It's increased by 38 times the use of telemedicine at the start of the pandemic between March, April 2020, and has now started to level out. But it has leveled out at a rate that is much higher than the rate of the use of telemedicine pre-pandemic. So there are some changes that are here to stay. It isn't necessarily at the same use as the mandatory use of it was at the very beginning of the pandemic, but there is definitely globally more willingness to use digital health technologies. And from the stakeholder side, from the payers and the provider side, there's more interest in investing in some of these technologies as well.
Well, I want to thank Rebecca Thomas so much for her time, her expertise, her passion today. Rebecca, thank you so much for being with us today. Thank you for answering all our questions. Thank you for your presentation. I appreciate you immensely.
Thank you, Mark, and thank you all for joining. I hope to see you all in a few weeks as we start this course.
And thank you, everyone. Thank you so much for giving us an hour of your time today. Thank you for joining us today for this informational webinar for Columbia Business School Executive Education's upcoming online program, Digital Transformation in Healthcare. If you have any additional questions, you can send them anytime to columbia@emeritus.org. Again, that's Columbia with a U, columbia@emeritus.org. Thank you all so very much. And until then, have a beautiful day. Thank you so much for joining us, everybody. Bye-bye now.